One big fear that got Africa worried finally arrived the continent on February 14, a day lovers were actually celebrating. It was the index case of COVID-19 that arrived in Egypt. Since then, over 2.5 million people have been infected, but wait for this, and over 2.5 million people have been cured of COVID-19. It wasn't a miracle. The frontline workers were responsible. But how have we cared so far for the frontline workers? A lot of people have died across the continent, in Nigeria, in Kenya, over non-availability of PPE. VSA will be looking at that. Welcome. Well, just last week, the Nigerian Medical Association said 20 doctors have died in just a week as a result of COVID-19 pandemic. Most of them died as a result of a lack of protection. Since Africa's first case was recorded, at least 30,000 health workers have tested positive across the continent, and at least 1,000 sadly have died. Now, in August, South Africa reported that 24,000 health workers have tested positive for the virus. African health workers have complained bitterly about the inadequacy of personal protective equipment and poor remuneration and rewards. This has led to a shortage of health workers, with those working already pushed beyond their limits. In Nigeria, Africa's most populous country, the hazard allowance paid to health workers is 5,000 naira. That's a little above $10 per month. Now, in Kenya, every health worker, ranging from medical doctors to nurses to pharmacists, have down tools over poor rewards from the government and lack of PPEs, even though that industrial action has been called off. In southern African nation, Lesotho, doctors took the government to court over their failure to provide the PPEs. Now, these doctors also decried their working conditions. Zimbabwe doctors also asked to be paid in US dollars because their salary in Zimbabwean dollars cannot afford basic health care, rent, or even their kids' school fees. Many health workers in that country are paid less than $55 a month, yet the money meant for these people are being used in the acquisition of automobiles like SUVs, motorbikes for the police and military. This is pretty much the case in most parts of the continent. Now, joining me in this discussion today on COVID-19 are two experienced African medical practitioners. They are in the system and have a lot to share with us. You're welcome on VSA, Dr. Osao Inabulele, President of Commonwealth Medical Association and past President, Nigerian Medical Association, and of course, Dr. Moses Masika, a virologist at the University of Nairobi, Kenya. Gentlemen, good to have both of you on VSA.
Thank you very much. Happy to be here. Great.
We've seen a lot of the struggles of health workers on the continent amid a rise in the number of cases. Is it a case of, the government's not seeing the health sector as very important, because a lot of people are still trying to put a finger on why they have ignored such an important sector. Let's start with you, Dr. Masika.
Yes, indeed, we have, I think, misplaced priorities, or many of our governments seem to feel that health is not a top priority, either during political manifesto campaigns or even during actual governance. And this has placed health sector in very many challenges, from issues with the facilities, with supplies, with enough healthcare workers, and COVID-19 has brought this to bear. It has really showed our big underbelly in terms of healthcare provision and services. And I think, although we've seen a lot of scramble to try and put this together, the gap was, put things together in the health sector, the gap was too big to fill. And we're still reeling from the lack of allocation of resources and proper management in the health sector. And it's worse now because a lot of our healthcare workers are dying from it, in as much as they should be the ones protecting us.
Well, Dr. Nabulele, you know, some have called these needless death. These are avoidable deaths. Tell us how this has been playing out, especially, I know these are trying times for you and your colleagues. Not too good a story coming out from Nigeria, you know, the numbers are rising. What do you think is truly wrong, apart from what we have seen about the PPEs?
Well, clearly, first, let me thank you for inviting me to this program. I'm glad to be here. We need to, continue with these conversations and hope that there will be some productive outcomes. Clearly, these issues are issues that have been, going on for quite some time. In fact, they've become very perennial. And all that has happened is that you have an amplification of these realities, by COVID-19. And somehow COVID-19 has been able to give the fullest expression to some of these inanities, that we see occur in the African health system, within the African health system, as depicted by the, poor political commitment of African leaders to the healthcare system. So what we see here is a situation where, even before now, you didn't have enough healthcare workers, for instance. And now COVID-19 has come to, of course, further stretch the capacity, demand for increase in the number of health workers, and yet you do not have this healthcare workers. You have few of them around because they have been failure to recruit over the years. And you have few healthcare workers doing the job, even more increasingly so, to attend to COVID-19 cases. And so you have greater exposure of these healthcare workers in the face of poor provision and poor supplies of the highly needed personal protective equipment. What you have, therefore, is you have more of them getting exposed, more of them coming down with COVID-19, and of course, even more of them being removed from the workplace, further endangering the fewer healthcare workers who are now available to do the job that ought to have been done by, an expected number of healthcare workers. Today, as I speak to you in Africa, generally, Africa has about 25% of the global disease burden. And you expect that Africa should therefore have more of the healthcare workers to attend to that very huge burden in Africa. But Africa today can only boast of about 3% of the global health workforce. And so all over Africa, in most African countries, you have very poor, numbers of healthcare workers, whether physicians, nurses, or even other healthcare workers, to attend to the increasing demands in the health system. So clearly, there's a very serious shortage of health workers in Africa, in Nigeria inclusive, and in fact, it cuts across all African countries. So you have this issue of acute and chronic shortage of healthcare workers, leading to more exposure of these workers in the face of demoralized, environments. African governments have hardly even, appreciated the healthcare workers, even in the face of this COVID-19.
Listening to you, Dr. Nabulele, it would seem as if you heard what Dr. Masika some days ago said on the program. He alluded to the fact that the continent hasn't actually done pretty well to preserve and care for the frontline workers in the face of what we've seen. There have been outbreaks of other diseases other than COVID-19. For instance, in Congo and a couple of other places, there are still, light Ebola cases. In Nigeria, there was the Lassa fever outbreak, and now yellow fever. With the inadequate or even lack of PPEs, what position is the government taking to help health workers? Let me bring in Dr. Masika here. The strike, the last time we spoke with you on Village Square Africa here, health workers in your country, Kenya, were on strike. Has anything changed since they returned to work?
Yes, indeed. There has been a little improvement. The government or the Ministry of Health negotiated with doctors on Thursday last week on the eve of Christmas, and they managed to get doctors back to work. But this was in the backdrop of other, probably even more crucial healthcare workers out of work, and this includes nurses, it includes clinical officers, it includes lab technologists who provide the most of the healthcare in the country, because doctors are probably in the towns and a few in the regional governments, and without the nurses, without the clinical officers, without the laboratory officers, they will not be able to work alone. So these other officers or healthcare workers have been on strike since the first week of December. This makes it at least 3 weeks on strike. And although the government was able to strike a deal with the doctors within a week or so, they've not managed, or they have not shown any willingness to do the same with the other healthcare workers. For some strange reason, I find this inexplicable. I would think that as a responsible ministry, we would want to get all our healthcare workers back to work. The grievances they raise are very legit. We have things about health insurance, because healthcare workers need to be able to be covered if they get sick from COVID-19, and this cover was removed. Is no longer being offered. They also are talking about provision of protective gear, which is quite crucial at this point in time, as many of them sometimes have to either buy their own or work without enough protective gear, risking their lives, and as well as getting paid some monies that were due to them, and the government had promised to pay them but has not been paid. So we've seen a very sluggish response. I would say I've seen very poor attempts by the ministry to resolve the issue with all healthcare, all cadres of healthcare workers. Although indeed the strike with the doctors was resolved, I don't think doctors would be able to deliver healthcare alone in our system, because there are very few in a very large country.
Well, I think quite a number of health workers have died, in Africa. Some of the best hands of, different countries. Listening to both of you, especially Dr. Enabulele, it cuts across, countries on the continent, which is sad. And I sense a semblance of the same kind of attitude from governments across countries, because this will naturally restrict the willingness of others. How worrisome can going to work get for a health worker in sub-Saharan Africa now, Dr. Enabulele?
Well, it's always been very challenging, and it has not changed, even in the face of COVID-19. It looks like African leaders somehow are inflicted with a very strange virus that makes most of them unable to appreciate the value they esteem, and the sense of commitment of healthcare workers, and of course the need for healthcare workers in their economies. Because if they understand, they seem to have failed.
Let me jump in here, because there seemed to be a glitch there on the connection with Dr. Enabulele. But again, we've both established, you've both established the problem. We'll take a moment. When we'll come back, I think time for us to start looking at solutions. If those in Kenya are back, to duty, as we wind down 2020, love it or hate it, the frontline workers are the heroes on the continent, and for so many other places in the world. They must be, revered, respected, and of course cared for. When we come back, how can all of these be taken into account so that we can have a better and trouble-free 2021? Well, I like to think that the continent will really be, seeing how important this sector is, more so to, actually put the gains on a scale of what the continent has seen from the frontline workers. Africa has more than 2 million health workers, and in its 1.3 billion population, and 60% of them are nursing professionals. In Uganda alone, South Africa and Nigeria, there are about 370,000 healthcare workers. Nigeria and South Africa alone have over 200,000 community health agents, but many of them poorly paid and not motivated. We've seen what is happening in South Africa at the moment, going into its third year with the super spreaders, spreading COVID-19, and of course in Nigeria, Kenya, and a couple of other places, health workers are being exposed because of inadequate protection for these people. Now, let's continue with Dr. Osahoin Abulele, because time for us to look at what the continent can do to reverse the trend so that we don't keep losing those who are concerned with making the continent a healthy one.
Thank you very much again. First, my heart goes out to all those health workers in Africa and indeed all parts of the world.
Well, I think we're having a bit of audio, what a day. It does happen when it comes to technology once in a while. Let me go to Nairobi, Kenya, where Dr. Moses Masika. Dr. Masika, we're talking about solutions now, things that we can do to reverse the ugly trend. Let's start talking about solutions.
Yes, indeed. For us to get the solutions right, we need to identify the problems. And the problems are key include the numbers. We do not have enough healthcare workers to attend to the COVID cases. We can get them. There are, especially in countries like Kenya and even other African countries, enough people have been trained to do this job, but they are not hired. They've not been hired. They are looking for jobs, and those who get hired have not been properly tooled. So after getting the right numbers is to make sure we protect them at work, we give them what they need to deliver their jobs, and this includes protective gear, but also looking at the mental health issues. We've seen studies globally showing that up to as much as half of all healthcare workers are suffering from stress, those who are taking care of COVID-19 patients. About a quarter will have burnout, another quarter will have depression. So we need to take care of these issues to make sure you have the numbers to relieve people so they don't suffer from burnout and get some breathing space to avoid depression and stress, and give them the tools that they require. And these are things that are well known that healthcare workers in different cadres require. And we also need to make sure we consider everybody, because we are seeing some people who are having solutions that do not cover all the healthcare workers. And the frontline workers are not just there. They include doctors, of course, and nurses, who are very key because they are dealing with these patients throughout, clinical officers who assist doctors and also see patients on their own, and also laboratory technologies, because these are the guys who collect samples. They collect, for example, the nasal swabs and the blood if we need it from the patient. And additionally, there are people who also do housekeeping. These wards where these patients are staying need to be kept clean. The patients also need food. There are people who are providing security in these places. So all these are frontline healthcare workers who need to be sufficiently trained about infection control with COVID-19. They need to be enough so that people don't do donkey shifts day in, day out. They also need to have the right gear so that they are protected. Above that, we need to allay some of the anxieties by making sure that they know if anything happens, their families are safe. Because we've seen, for example, healthcare workers who die in the line of duty, the states will just take care of the funeral expenses, and their family is left in very economically tough situations without any compensation, without any care of what responsibilities these healthcare workers had. Additionally, things like health insurance that will help these healthcare workers to know that if anything goes wrong, they will get the right kind of treatment at whatever cost, so that they know basically that the country has their back, so that they can take care of the citizens without any fear. Additionally, we also need to continue to have the supplies, the beds that are required, the space that is required for COVID-19 patients, because one of the other things that makes the work of healthcare workers difficult is having to work in strained or resource-strained places is when you don't have enough supplies to take care of the patients that you're taking care of, or even beds. We've seen instances in Africa where people have to share beds. You can imagine in a COVID situation how that would be. So I would say the problems are well known, the solutions are within our reach. We just need to allocate our resources wisely and use them for what they're supposed to use.
Let me bring in Dr. Osayo Nabulele. He's the president of the Commonwealth Medical Association, and he's also a past medical president of Medical Association in Nigeria. So I'll call you a medical unionist. This resonates with you listening to Dr. Masika, the demands, I think, and the pain these people go through, especially when they die in active, in the line of duty. Tell us those things that you think can be done for these people to immortalize them, for those that are gone and those who are still working, to make this something that is a bit okay for them to trudge on.
Yeah, thank you very much. I hope you can hear me.
Absolutely.
I honestly think that there needs to be a paradigm shift. A paradigm shift in the sense that first we need to start having what I consider really health-conscious leaders across Africa. Because unless and until you have health-conscious leaders across Africa, all the theories and prescriptions will end in naught. So you need people who understand the nexus between the health system development and economic prosperity and well-being of every country. So if you have such leaders, then they will prioritize the welfare, the working conditions, and the incentivization of healthcare workers and all those who work within the health workspace. Indeed, they will promote good governance. So first is to have health-conscious leaders who appreciate these realities and this nexus. Secondly is to have an empowered citizenry. You need people to be able to demand accountability from the political leaders. That, look, you need to give priority to health and the healthcare workers. With respect to healthcare workers, aside from what the doctor from Kenya has stated, which I do not want to rehash, of course, there are all forms of recognition that should be given to healthcare workers. All right? And it goes from simple appreciation of their sense of what? Their sense of commitment, their sense of diligence. Because appreciation is not necessarily in the rollout of financial incentives. That you even appreciate them on a weekly, daily basis, or even monthly, yearly basis, is enough to, of course, lubricate the esteem of healthcare workers. Then, of course, for those who have done, substantially well, and this includes even all those who have died in the course of service, nothing stops a government from immortalizing them in various ways, either by, of course, institutionalizing some foundations or even, programs, after these healthcare workers. Of course, you can name edifices after healthcare workers. It's not only politicians that deserve such, mementos or whatever, or whatever recognitions. Even healthcare workers are deserving more of such.
Absolutely.
And COVID-19 has proven that. So I think that for me is to remove, first of all, that very negative virus that has afflicted most of African leaders, to blind them to the reality within the healthcare industry, to appreciate the value and, of course, the very huge potentials, within that space. I wrote an article recently, which was published by the World Medical Journal, and I tried to address an hypothesis which I put on as to whether COVID-19 really is going to serve as a reversal mechanism for the kind of negative attitude we have amongst African, political leaders.
I think that's something that, sorry to cut you there, that's something I think we should talk about in the days ahead on the program. If you don't mind, in the new year, I'd like to bring you and Dr. Masika back again to talk more on this issue. Whether the continent likes it or not, there is something that we must say about the frontline workers, and that is why here on Village Square we say they are our heroes, and we're hoping that in the new year this recognition and care for the health workers will continue. So that's a promise that we have to keep for 2021. We'll look at that document, we'll look at the policies and see how COVID-19, which is one issue that cannot be overflogged, definitely can be brought up again in the year so that we can avert possible pandemic that may emanate as we go on here. Those have been insured, who have been insured, can stay up pretty much and get things working for us as a people and as a continent. Gentlemen, many thanks for being such nice company on the program today. We'll come again tomorrow, but we have a date in the new year to keep looking about talking rather about the health sector. Dr. Moses Masika, Dr. Osai Inabulele, many thanks. I'm Sulaiman. I'll see you again tomorrow.